Hello, my name is Henadine Figueroa, and this is my head-to-toe video for advanced health assessment. This is my patient Jordan. He is 24 years old. Before the beginning of this exam, I washed my hands and introduced myself. I had him empty his bladder. I measured his height and weight and also his vital signs. I checked for his far vision using the Snellen chart and his near vision using the Rosenbaum chart. And so we'll begin with inspection of the head. His head is round, normocephalic. The hair distribution on his head is even. The skin on his scalp looks a little paler than the skin on the rest of his body, which is normal. I will palpate his skull for any masses or tenderness. And I don't feel any of that. I also feel that his hair is coarse, but clean, and the hair follicles don't fall off easily. Looking at his face, the skin is clear and intact, no discolorations. His facial bone, I don't feel any masses, and it's non-tender. We'll start with his external features, which is his eyes. They are equidistant from his nose. His eyebrows are present, and they're symmetrical. The hair distribution on that is even as well. I don't see any lesions. Whenever I close your eyes, feel his lids, there are no tumors on his lids, no abnormal movements in his eyes. And I will look with my pen light and look at his eye structure. His sclera is white. There are no exudates. His conjunctiva is transparent. There are some blood vessels that you can see, which is fine. No swelling or lesions in his eyes bilaterally. His iris, they're brown. The color is evenly distributed. His pupils are both round. They're reactive when I shine a light in them. They're approximately 4 millimeters in diameter. And we can test for his vision other than the Snellen chart and the Rosenbaum. I'm going to do a confrontation test. So Jordan, I'm going to stand really close, and you let me know whenever you see my hands in your peripheral vision, okay?
Good. Good. Good.
Okay, good. Also, I'm going to do the 6 fields of gaze. So just keep your head steady and follow my pen, okay? And then there's some convergence there as well. I'm going to do the accommodation test. So Jordan, here's my finger. Look at it. Look at something behind me. And then look at my finger again. Okay. You should see his pupils focus and constrict whenever he looks at my finger. And then, again, for pupil constriction, we can test his constriction using the direct and consensual. So I'm going to shine a light in his eyes, in his left eye first. The direct would be looking for the constriction in the left eye. Good constriction there. Consensual would be checking for the constriction in the opposite eye. Good there. Next, I'm going to do the cover and uncover test to check for strabismus. So Jordan, take your right hand and keep looking at me. Look at my nose. Cover your right eye. Uncover. Cover again. Uncover. His eyes have normal alignment, no extra movement. Do it with your left hand and your left eye. So cranial nerves 3, 4, and 6 are intact. We can do testing for cranial nerve 7, which is his facial nerve, by having him do a series of facial movements. Jordan, wrinkle your forehead. Shut your eyes. Give me a smile. Frown. Clench your teeth. And then I'm going to do this TMJ, check for popping. Move your open and close. No popping or clicking there, and then move your jaw from side to side. Okay. No popping or clicking there as well. Now we can check for the cranial nerve 5, which is his trigeminal, and I'm going to have him close his eyes and have him tell me if he feels me touching his face with a soft object. Close your eyes.
Yes. Yes. Yes.
Okay, great. Those are intact as well. Now we can move on to the ears. They are positioned centrally. The skin matches the flesh color of his face and the rest of his body. I don't see any swelling, and I'm going to palpate his auricles. No tenderness there. They're firm but mobile, which is good. And then I'm going with my otoscope to look in his ears. Up and back. Okay, looking at his ear canal. Good. Looked at his ear canal. There was no redness, swelling, or discharge. There was just slight cerumen, which is okay. I didn't see any lesions or abnormal drainage or fluid collection. The tympanic membrane looked pearly gray. I could see some blood vessels. There no bulging or retraction, or again, any fluid collection. So we can test his hearing. First, I'm going to do the whisper test. So I'm going to stand behind him and say a word and see if he can hear it. Cover your left ear.
Baseball.
Jordan, cover your right ear.
Christmas.
Great. Now I'm going to do the Weber test and place the tuning fork centrally on Jordan's forehead. And let me know if you hear it in your right ear, left ear, or both ears.
Both.
And now I'm going to do the rim test. And I'm going to put it behind your ear. Let me know when you hear it stop, the noise stop, and then I'm going to put it in front of you and let me know when it stops again, okay?
Stop.
Okay. So cranial nerve 8 acoustic is intact. Now we're going to look at Jordan's nose. Upon inspection, it is midline, symmetrical. Again, the color of his nose matches the rest of his face. Upon palpation, it is firm, and there's no tenderness there. I forgot to assess for sinuses, his frontal and maxillary. No masses or tenderness felt there too. Back to his nose, I'm going to look with my otoscope again. Tilt your head back. Okay. His nasal mucosa is glistening and pink. I do see some hair, which is okay. There's no swelling. In the turbinates, there's no swelling there. The septum is midline. I didn't see any perforations, and there was no bleeding. So we could do the nasal patency test to see if there's any sort of obstruction. So Jordan, cover your right nostril with a finger and breathe. Okay, good. Now your left nostril. Okay, good. Okay. We could have Jordan olfactory nerve tested by having him discern different kinds of smells as well. Okay, moving on to the mouth. Upon inspection, his lips are pink. The membranes are moist. I don't see any cracking or lesions or any sort of inflammation. Okay, I'm going to look in your mouth. Okay, the buccal mucosa is pink, moist, and smooth. His teeth are ivory in color. There's about 32. His hard palate and soft palate are all concave. They're pink. I don't see any lesions or malformations. His throat. I'm gonna actually look in your throat. Say ah.
Ah.
Okay. His soft palate and the uvula rises whenever he says ah, which is a normal finding. His throat also looked pink and vascular. There was no swelling or exudates. Now I'm going to have you, we're going to test his cranial nerve 9 and 10 by having you swallow. So take a drink of your water. Good. Okay. And then I'm going to test your gag reflex. Okay. Gag reflex present. Sorry, doesn't feel good. Okay. So for the cranial nerve 12, this hypoglossal, Jordan, push on my hand with your tongue against your cheek. Do this one. Good. Now stick out your tongue a little and move it up towards your nose and down towards your chin. Perfect. Good. And so those are intact. Now I'm going to move down to Jordan's neck. They are symmetrical in musculature. They're smooth. I don't see any visible JVZs from this angle. We can do some range of motions, passive and active. So Jordan, tilt your head back, forward. Now look at me, and then try to reach your ear to your shoulder. Other side. Good. Okay, for the active, I want you to shrug up against my hands. Good. Okay, and now push on my hand towards this way, and now push on this way. Okay, so that's testing cranial nerve 11 for the spinal accessory muscles. I'm going to check for his carotid pulse, one at a time. Good pulsation. The pulses are palpable, and I can feel them bilaterally, and they're strong, and the rhythm was regular. Also, I can check for his tracheal positioning. They're midline, and there's no tugging. And for his thyroid exam, I'm going to do the posterior way to do it. So I'm going to come behind you and find his crackling, and just below that. Okay. So right now it's smooth, and then swallow. Okay, good movement of the cartilages there. I'm going to move one thyroid gland, feel for the other, move the other. There's no tenderness or swelling there, and it's smooth, which is a normal find. Assess for his lymph nodes, and I'm going to start with the occipital, post-auricular, pre-auricular, submandibular, submental, anterior cervical, posterior cervical, deep cervical, supraclavicular, infraclavicular, and then I'll do his axillary, so flex your arm and I'll support it. Okay. No lymph nodes palpable there. I'm going to take the bell of my stethoscope to listen to his carotid artery and also his thyroid for bruits. Okay, no bruits heard. We'll move down to Jordan's upper extremities. And they are equal in length. The musculature is even. His skin, might have you take your shirt off later. His skin is warm and dry. Check for radial pulses, and they're present and palpable and even and regular rhythm and rate. We can check for his reflexes here. So I'm going to do bicep, triceps, brachioradial. Okay, good reflexes there. I'm going to do it on the other side. While I'm here, we can do some musculoskeletal testing. So Jordan, we can do some adduction and abduction on his elbows. So go that way against my hands. Good. Go this inward. Good. Now flex your hands like this. Okay, pull me towards you. Good. Away. Good. Now extend out your hands, your wrists. Pull in towards you. Now push on me. Good. His strength is equal and he's strong. And now we're going to move down to his chest. So can I have you take your shirt off?
Okay.
So the shape of his thorax is slightly elliptical. His anterior, posterior to the transverse diameter ratio is about 1 to 2. His symmetrical, the skin is symmetrical on both sides. His shoulders fall evenly. His skin is clear and intact. It is warm and dry. His respirations are unlabored. They're even. His breathing is non-exaggerated and it is effortless as well. So I'm going to I'm going to have you turn that way. No, this way. Okay, yes, yeah, like that. Okay, so I'm going to measure this thoracic expansion. I'm going to find the level of the 10th rib, about here. Squeeze the skin a little bit and have it take a deep breath. Exhale. And the movements of my hands were symmetrical, so that is a normal finding. We can test for the tactile firmness by having him say 99 and move my hand down using the ulnar surface of my hand. I'm going to have him say 99 and move down the lung fields.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. And then I'm also going to percuss down the lung fields, making sure that I stay away from his scapula. Okay. That all felt fine. And I could measure his diaphragmatic excursion, which is the measurement of the contraction of the diaphragm during breathing. So, Jordan, I'm going to have you take a deep breath and then hold it, and then I'll let you know when to breathe again, okay? Take a deep breath. Hold. Okay, right there. I'm going to mark it with my pen. Okay, exhale and breathe. Okay, and then, so I marked where I heard the change in note from resonance to dullness, and then I'm going to have him take a deep breath again, exhale it all out and hold it, and I'm going to mark where I hear the change in note from dullness to resonance. Okay, ready, Jordan? Inhale, take a deep breath, exhale, all the way out and hold it. There. And that's about 4 centimeters, and the normal finding is from 3 to 5, so that is normal. And then I will use the diaphragm of my stethoscope to auscultate the lung fields. Deep breaths in and out, okay? And then laterally. Okay, breathe normally. The right middle lobe is best heard laterally, so make sure that is done as well. I didn't hear any adventitious lung sounds like hoarseness or wheezing or rales, as Jordan is a healthy male. Turn back around, Jordan. You can look at his anterior chest. Again, his skin is even, dry, and intact. Now, looking at again the anterior chest with a cardiac specific this time, I don't see any pulsations. Actually, can I have you lay down with your head this way on this side? Yeah. Okay. No pulsations on his chest, which is good. I can palpate his precordium starting at the apex. And then left sternal border. And then base. I did not feel thrills. I will auscultate using, again, the diaphragm of my stethoscope for his heart sounds. Start with aortic, pulmonic, herbs, tricuspid, and mitral. Good sounds, S1, S2, regular rate and rhythm. I didn't hear any murmurs. We will move to the abdomen, and I'm actually going to have Jordan move over to the other side of the bed. So, looking at his stomach, I can shine a light here. I don't see any bulges. I don't see any movement which would indicate peristalsis. His umbilicus is midline and inverted, which is normal. So now I can start palpating. The skin is also warm and dry, and even throughout, I can start palpating using a light palpation method in all quadrants. And then we can go deeper using one hand or bimanual. I'm just going to do one because Jordan's not very big. Okay, I don't note any masses or tenderness there. The liver on this side, so I'm going to place my left hand underneath him. Okay, go ahead. And I'm going to press down with my right hand, looking for the liver edge, which ordinarily is not palpable. Check the spleen on his left side, so turn a little bit, perfect. Push up on his abdomen and press down with my right hand. And take a deep breath. Okay. I don't feel the spleen there either. It is ordinarily not palpable as well. If it is, it might be enlarged. I checked the left kidney. Okay, and I don't feel that as well, which ordinarily is also not palpable. With the diaphragm of my stethoscope, I can listen for bowel sounds, making sure to listen in all four quadrants. I note active vowel sounds in all four quadrants. I'm actually also going to first percuss. We're looking for tympany and then dullness over the organs. Okay, good sounds there. Again, with my stethoscope, I'm going to listen at his arteries. Listening for any bruits if I hear them. I'm going to start with the aorta, renal, iliac, and femoral. So renal. So this is the aorta. Renal would be on both sides. Iliac is lower on both sides as well, and then femoral. No bruits noted there. We are going to look at Jordan's lower extremities. His legs are, stick them out for me really quick, even in length. There's hair on his legs, which are evenly distributed. His musculature is even on both sides. His skin is warm and dry and is the same color as his flesh. His nails are hard but smooth. The capillary is less than 3 seconds. I didn't do that on your hands. Let me check for vasculature. His nails on his hands are hard and smooth as well, and less than 3 seconds capillary refill. Do some musculoskeletal testing here by Jordan push against my hands. Okay, now in, good. See your feet. Okay, move towards you. Push up and down. Okay, good. I'm gonna support Jordan's legs. Do the patellar. Good reflexes there. And then his ankle jerk. Okay, other side. Okay. Good reflexes, and they're equal on both sides. I feel it there. I feel the pulsation, and the rate is regular and even. I'm going to check for the posterior tibial, which is right behind the ankle. Good. Dorsalis pedis. Good pulsations on both legs throughout. I'd call it a +2. The rhythm and rate is regular as well. Actually, cervical, thoracic, and lumbar. So extend back, lean over, and then forward. Okay. And then also when he's leaning forward, and just hang your hands down. We're looking for any abnormal curvature, and he doesn't have it. It's even and smooth. Now stand up. Okay, now we go from side to side. Good. And then move your shoulder, keeping your hips straight. Go that way, the other way. All of those movements are smooth and painless.